of the chest, right? And we want to start pumping down 2 to 3 inches. When he's done, you're going to hear that noise, right? On a real life person, you might hear something crack or pop, right? That is normal. It's a side effect of performing CPR. You might break a rib depending on the person's the pressure, but most likely, I mean, I can't count how many times I've done CPR and you get to that point, but it just means you're doing it right. It's not to say that you are looking to crack a rib, right? But it's something that can happen when you do it successfully and you're going down those 2 inches to make sure that you're pumping that hard.
I was just gonna say, and I know that sometimes I can feel, you're gonna feel a little, your initial instinct is gonna be to back off, but keep the compressions because a broken rib can heal, but if the oxygenated blood is not going through the system, then they're not gonna make it, okay? So, as much as, it's a unforeseen aspect of it, it's better to have them heal from a broken rib and have them still be alive, right?
Correct. And it's something that's also understood by medical physicians, and as a result, you are protected by the Good Samaritan law, right? So someone wake up, they're alive, and they're like, you broke my ribs, I'm gonna sue you. That they can't do that, right? One, because it's understood for it to be a side effect of the procedure itself, and you attempted to perform a life-saving procedure during those circumstances. So you're good, right? And then we want to push that, when we were pushing down, performing compressions, we want to be doing 100 to 120 beats per second, and that goes something like.
And I'll play the song too.
Oh, you got the song?
Yep. So.
Oh, I was gonna sing it. I was like. I need a mic. I need a mic to sing. I should have knew that we were in church, man. I should have known these mics in here. That chair, still that chair.
So we'll do a little run through. This person is hanging out, all of a sudden they stop breathing, have a heart attack, they go down, right? What do you saw first?
Call 911. Someone call 911. I have no pulse. He's not breathing. She's not breathing.
So it'll be to the beat.
Staying alive. Staying alive. Make them alive.
So the song is playing 100 beats a second, right? So how do I know or remember? And the reality of the matter is an emergency situation. Most people don't feel comfortable in something like this, watching somebody drop dead. So how do I remember how fast I should be going?
Right.
Too fast, too slow, it doesn't work, right? So how do I make sure that I'm pumping at the right speed and the right depth? Staying alive, staying alive. It's what I do, sneaking a little prayer in between, man, and hope they make it.
Same thing work for children.
Yes, you can do the same thing for children. The only caveat to that is if it's a newborn baby, what we do is we have
I'm the baby.
So for newborn babies, you're gonna do 2 fingers, right? Because their body can't handle a hand, and you just press down, and that alone will be enough. Yeah, same spot. So you want to be again in between the nipples, what we call the sternum, right there, right? You don't want to be too low because that's like your diaphragm where you're breathing. You don't want to be too high. That's not going to be much. So right in between the nipples.
And remember, it's also a baby, so you don't need to apply as much force, right? You don't need to be on top of them. That's what she mentioned. Cecilia mentioned the 2 fingers. And you gotta do a little bit faster because it's an infant or a baby.
So we're gonna have some fun right now. Typically we would say that we usually put the mannequins on the floor, but it can be on the table. I'm gonna go around, we're gonna play the music, You guys are gonna try compressions for about 2 minutes. Remember, responders usually get there 3 to 4 minutes, so we're gonna do it for 2 minutes. And as you guys are doing that, we'll go around in correct form. The other thing while you're doing CPR is you wanna kinda lock out your elbows and use your body, like the swing of your body. Otherwise you're gonna be tired. And you guys will feel that.
Yeah, you may not do it on the floor, but you're gonna have to get up at least to be able to perform it.
If you start going like this with your arms are gonna get tired and you're not gonna have as much strength. So, alright. And don't worry, whoever doesn't have a mannequin, we will switch out and try that again. Okay. So what is the first thing we do? Awesome. Then we're gonna check for breathing. Are they breathing? Not breathing? Check for pulse. Okay. And then, so they're in a cardiac arrest, so CPR, compression.
Doing it right.
Bring your whole body, your head.
What's that?
You're bending at the hip, using the weight, plus your shoulders, plus your elbows. You're bending at the hip, you're using your whole body weight off the body. Yep. It's a workout, it's a workout.
It's tiring already. It's tiring already.
Faster. Faster.
Okay. Very good. Look out, Lynn.
Yeah, it's a workout. Yeah, CPR edition, you know. It's a workout. Put your whole body into it. When you're on the floor, it's easier. You're stretching up your lower body, your upper body, over the person. Let your own body weight drop down. Your head, up, your shoulders, elbows, that weight. Alright.
So that's that you have the full arch, you're not gonna start with the whole.
How many counts should I do?
And then you're gonna do between there, you're gonna make sure you know your elbows.
Yeah, we're not even counting how many times, then we count reps.
Yeah,
So, I mean, usually we do 3 reps back to back, for breathing, but we do them on the
Oh, not that. All right, good. Everybody give them a hand. Yeah.
Wake up!
All right, you guys saved somebody's life. You had a really good question. You said, how often do you check the pulse? So, don't. Leave that to responders when they come. The most important thing is keeping that oxygen flow going. Because every time you stop, it takes a long time to build up the pressure in the back, right? So you want to avoid stopping compressions as much as you can. So that is a little taste. That wasn't even 2 minutes, so it is a workout. I'll tell you that.
Another thing that can be done as well, if there's somebody else around you that you know or whatever that can help, as you're performing it for those initial, let's say, can't do 2 minutes, 90 seconds, even a minute, you're like, try to have that person and you can just talk them through it. You see what I'm doing right now? In about 15 seconds, let's try to switch. Put your hands where you see them right now. We want to do it this fast, as fast as I'm doing it right now. And try to help them with their beat to keep them. Yeah.
Call
And this
911.
is how we would do it on scene as well, right? I'll be breathing. I'll technically be breathing for the patient or be on the side because there's usually 3 of us.
Alright, I'm tired.
She's tired.
Alright.
And then,
So we minimize that time.
so we'll just do that immediate transfer. And that is all communicated prior to the transfer, right?
Right.
To make sure that we keep the pressure up and the heart pumping.
Right.
And you just like 911, we'll be discussing that with you through the phone. You could bring somebody, tag them along and say, all right, we need to switch, boom. It's okay to say that you're tired. We want to make sure that we perform the best for the patient. And say, I need somebody else to tag along or something.
Got a couple questions.
Yes, yeah, if you mind doing the questions, I gotta change this.
Question?
Absolutely not mouth to mouth?
No, so we're only doing CPR.
Okay.
Hands-on CPR, we're not doing mouth-to-mouth, we're not doing, that's what we're covering today. There's only, as we, explained a little bit earlier, there's already oxygenated blood within your system, right? Once your heart stops pumping. So what we wanna do is do the job of the heart, which is to pump the blood and move that blood around your body and make sure that the oxygenated blood is moving around your body. Right now, doing mouth to mouth as a whole, that's a secondary step to oxygenate the lungs and oxygenate the blood. If you love that person, if you know that person, right, it's a whole different thing, which also helps the survivability of the person. It's a word to say for me. Yeah, I ain't stumbled that much.
So when we're thinking about this, just remember that you're gonna, most likely, I'd say, than not, you're gonna be doing this on somebody you love, right? I think about 73% of cardiac arrests happen inside the home, okay? Then the rest is like out in public, but this is most likely gonna be for somebody that you love and care about.
You mentioned about if you feel like tingling in your arm, does it depend on what side? Does it matter which side?
The left.
Usually the left for the heart?
Yes.
Or it's for,
So yes, but the symptoms, there's people that don't get any symptoms, right? So it's so, the symptoms for a heart attack vary so much. There's somebody that could be sweating and feel a little bit of pain, there's somebody that could be excruciating pain, bent over, have the tingling. Women more often than men suffer silent heart attacks, so they may not have any symptoms until something happens, so, yeah. But yeah, typically, I would say if you feel any tingling and you have, you feel nauseous or just call 911. It's better to catch it before that happens, you know? So.
If you know someone is going in cardiac arrest and you know that's what it is, but they haven't completely passed out.
Call 911. And don't, this is only when they are down, they don't have a pulse, and they're not breathing,
okay.
okay?
All right.
So that's why we always check those 2 things first. Because we're also gonna talk about overdoses, right? It's something that if you're out in the community can happen. And they, initially, somebody being down could present the same way, right? But there's things to look for. So if you're gonna be getting compressions, you wanna make sure that they're, you know, you can go like this to check their breathing. You can also look at, their shirt just to see the chest rise. You know, that's another way to check breathing. But always check for breathing and check for pulse.
Difference between cardiac arrest, right, where someone's flatline, and then heart attack, which someone's still moving, they're alive, right, they're breathing, they're just having symptoms and their heart is starting to malfunction.
Okay,
So,
all right, thank you.
AEDs, now, AEDs, once, somebody's heart stopped, right, and they're going into cardiac arrest, how do we try to jump start them, essentially, right? We know that our body runs on electricity, right, to an extent, right? So we brought some products, is it the real one there?
Yes.
So we also pair up the CPR portion with the AED, right? Now, The good thing about the AED, very easy to use. As soon as you turn it on, it walks you through it. What to do, pictures of where to place the pads, and when and if you need to shock the patient, it is gonna talk to you and advise you of all these steps one by one, right? So, hey, you call 911. This person's not breathing. This person doesn't have a pulse. We need to begin CPR. If there's someone else, or if it's just one person, hey, call 911. While you're at it, go grab me the AED, right? So go grab the AED, bring it over. We should be knowledgeable of where the AEDs are placed here in the temple or the church, right? So where are they? So everybody, the deacons, know where they are, right?
So I was gonna say, they're different, they may look the same, they may look very different, but they don't operate the same. We will go through, so. Alright, let's just say this is our person down. We have places where we're gonna, place the pads, right? We're gonna place one on the right chest and then the lower left side, so right under your rib cage or chest area, right? So typically, this is our training AED. I'm just gonna go through what it sounds like. But this is the AED that you guys have here in the church, okay? So again, you're gonna see two major commonalities. So they're gonna have the green button to turn it on, and then they're gonna have that orange button, and you may not see it on the trainer, but it has a little lightning, just like this one does, okay? Right? So the way they operate is gonna be the same. So one misconception is that this will restart a heart that's not working, and it will not do that, okay? What this does is it looks for an irregular rhythm. And if it's an irregular rhythm, once we put on the pads, it'll advise you to shock, which is this button here. What it'll do, it'll give it like a jolt of electricity to get it on its regular rhythm. Now, if you're doing CPR, the person goes into cardiac arrest, and they don't have, their heart's not working at all, this is not gonna shock them and bring them to life. Okay? We see that a lot in the TV, in the media. It doesn't do that, okay? So again, the priority, I wanna say, is always gonna be compressions. You do this if there's other people around that you can have help you, but you're never gonna stop compressions for this, okay? So on top of, that picture, the pads have pictures on them, okay? Oh, well, most of them, I would say, yeah. The ones you guys have here have pictures on them as well. There's like I said, various different types, so we're gonna put this on the chest, and they're sticky. So with this, you wanna make sure that their shirt is up. You can cut their shirt open if you get a chance, and then put these on, and then just throw it over for decency. But it has to be on bare skin.
Also, I don't see it like a razor, so if someone is hairy, has a hairy chest, you might want to shave the particular area, so you're making that direct contact with the skin.
Are you gonna have enough time to shave somebody?
Yeah, if you don't have time.
Yeah.
Well, if they're very hairy, you're gonna have to do it, because otherwise it's not gonna be.
And excessively where you can't stick it. There are people like that.
Yeah. Yeah.
Like his band. I'm joking. Yes.
So, could you tell people what AED means?
Look that up.
I know.
Arterial.
Yeah, wait a minute. Atrial arterial defibrillator.
I forgot what the E is on my
Yeah,
You got me
I had
on
to think about that.
that. We use the term AED so much, that's just.
Yeah, you got time to do it. And also, tell us what positions you're putting in.
So we don't get into, again, right chest, lower flank, we don't, get into, because for EMTs, there's like 6 leads, 12 leads, we don't get into any of that. We just want a connection, the heart is here, we want a connection between the right chest and then the lower left side, okay? Alright. And again, most people, like at this point, responders will be on scene. But, when we talk about the heart, it gets complicated. So, okay, so we're gonna turn this on, green.
Analyzing heart rhythm.
So it's analyzing, so when it's doing that, you don't wanna touch the patient, because you want it to figure out what's
Do
going on with the
not
heart.
touch the patient.
It's a little slow.
Shock advised.
So shock advised, that means it found it in regular rhythm, it's gonna tell me to press this button.
Charging. Stay clear of patient.
Stay clear.
Analyzing interrupted.
That means somebody touched the patient. It's
Do
fine.
not touch the patient.
I said.
Shock advised. Charging. Stay clear of patient.
Usually it tells you to shock the patient after the surgery.
Deliver shock now.
So that's what
Press
we're
the
pressing.
orange button. Shock delivered.
Shock delivered, once the shock is delivered,
Begin CPR.
continue compressions immediately. So. And again, they'll all give you the prompts, just listen to what it says. It may say analyzing patient, so again, you're not gonna touch the patient while it's analyzing, because you want the machine to figure out what's going on with the heart. And it may say shock not advised. As soon as it says shock not advised, you can begin compressions. If it says shock advised, it'll charge, it'll tell you to press the orange button, and then once the shock is given, you hop back on compressions, okay? So that's it, I'll just go ahead and, I see somebody here has been very diligent, they have, when the batteries have been changed, which is amazing, because oftentimes it's put on the wall and forgotten about, so. Like I said, most of the AEDs, because this is not something we, talk about all the time or use all the time, they have pictures to show you. But again, seeing this firsthand before will make you more comfortable when doing that. And then this one tells you, this is for 55 pounds and up. When AEDs first came out, there were different pads for children and adults. Now you can use the same pads, however, where you place them is gonna be different, right? So if you have a kid, you're gonna place one pad in the front of their chest and one pad in the back. But you can use the same pads, okay?
They could be as young as 1 year old, younger than 1 year old, right? Babies, infants, as long as you follow that procedure. Question?
So the machine knows how much of a charge to initiate?
Yes.
Okay.
They made a fireman proof, so we can't mess that up.
So, this is, I don't know if anybody here, this is a challenge, like if anybody here has family or friends that are hard of hearing, this would be difficult for them to use because everything is prompted by sound, right? But the newer AEDs, they do have, kind of like a bar where it tells you, it kind of gives you prompts by colors, like what to do, like green, charge, or whatever. And they have captions on the new ones. I think we're heading that way to be more inclusive, but that's just something to take note of if somebody's hard of hearing.
I got a question.
Yes.
When do we not use that?
That's a great question. If you are anywhere near the water, I would probably stay away from using this. And again, I'm gonna emphasize compressions are most important. But if it happens by a pool or somebody's submerged in water, just refrain from using that. Let responders do that, okay?
Another question. When it comes to those patches, does it matter which one you put at the lower left, upper right? Did you mess that up or?
It'll work either way, but typically there's pictures to show you which one.
Okay.
Yeah. And they're easy to remove, so if you have the time and you see that they're placed wrong, again, it should be a two-person operation. That person can switch them really quick. Yes.
What if the person has a pacemaker?
You can still use it with Facebook.
So I find those machines in public places. Do you suggest that we have them in our homes?
These are very expensive. The pads alone, like for the one we use, the pads alone are like $600. So that's why you see, there's different models, but yeah, I wouldn't recommend it. Again, what's gonna make the most difference is gonna be the compression suppression.
Narcan. So going over Narcan, opioids, I'm sure, I don't wanna assume, but that we've heard about what we're dealing with in our communities, right? Where we come to drug addiction, overdoses, right? This new drug has come out called Narcan, which helps, right, revert some of the effects of opioids in the brain, right? Just like CPR, the first thing we wanna do, if we notice that somebody, passed out or fell or whatever, we don't know, is it heart related, is it drug related, right? First thing we wanna do is call 911. Some signs of an overdose, depressed breathing. What's happening in the brain or when people overdose is that your signals are being blocked within your brain, and it's basically your body's breathing system starts to shut down. So the person begins to breathe shallowly, very shallow, and may stop breathing at some points. You can notice pinpoint pupils and or loss of consciousness as well when a person is overdosing, right? We want to be careful when you approach a person, and especially in an outside setting or any setting. You want to take a look. Let's not just quickly just jump in and start touching and start, because some of the opioid drugs can be absorbed through the skin, right? So as soon as you touch it, it can get absorbed through your skin, and if you're somebody that doesn't use, and you run into something, especially nowadays where you might have some of these drugs being laced with fentanyl, a couple grains of fentanyl is enough to kill a man that doesn't use regularly, right?
Yeah. So, when he mentioned, does everybody know what pinpoint pupils are? So that means, when your pupils are very, very small, okay, almost like a pinpoint. So that is a sign that somebody's on an opioid, okay? Some people have smaller pupils as it is, but, yeah, if it's really tiny, that's a sign on top of the depressed breathing, like he said. So what that looks like is, we also term it agonal breathing. So it'll be, usually people have about 12 plus breaths per minute, but like he did, it'll be, and then there'll be a period of no breathing, and then it'll be another big breath or something. Or too much space in between them, right? So.
Are you still getting?
No, at that point, they're so, how we talked about assessing the patient. So let's say this patient is barely breathing, right? Then I check their pulse, they're gonna have a strong pulse.
Yeah.
Okay, so that's how I know that this person is not going through a cardiac arrest, but instead it's something else going on. At that point, I would check their eyes, and their pupils are very pinpoint. Then I'm gonna suspect opioid, and you can give them a Narcan if that's around. Narcan they have Narcan boxes throughout the city. Most schools, public buildings have them. So,
How do you give it to them?
Is it advisable to have some Narcan sitting in the area where that's kept?
You can, yeah. And the county gives out free Narcan. So that might be an avenue. I don't have a direct contact. That might be an avenue. Yeah, but he can do that.
Okay, all right.
So this goes, is administered through the nose, right? So it's almost the same way that I'm holding it right now. I don't want to open it, but you would hold it like so, right? You see the middle part is the part that I would push down in, and going through either nostril, and just push it in and squeeze in, quick, goes into the nose. At that point, you might wanna take a step back, let it do its thing, see how the patient is reacting. Some patients may come out of a, combative, right? A lot of them come out in denial, like, no, I was good, nothing happened, I was just, they don't even know that they were dying, right? So you wanna look out for that.
I would say the other thing that we're seeing too, let's say somebody already administered Narcan, like you're in a public setting, what we're seeing is that they'll give somebody multiple of these. What you wanna do is you wanna give one and wait about 5 minutes. By then, responders will be arriving on scene, let them take care of it. As firefighter council said, if we give too many of these, because again, back to that media thing, right, with the AED, the concept with these is you put this in their nose and they're gonna pop right back up. Well, that was a couple years ago. The drugs got stronger, right? So now you can give this to a person and they may still stay down. But within 5 minutes, you'll see that they're breathing. Yeah, it improves, they're breathing a lot more. So at that point, you just wait for responders, right? Because they're getting oxygen. Now, what people are doing is they're giving 3 or 4 of these because the person's not popping up, alert, and that's when they come out combative. Because they're high, whatever they just had in their body reverses like that, they come out aggressive, they can come out throwing up, they come up swinging sometimes, so that's where you wanna be super careful. So I would say administer one, wait 5 minutes, and then at that point, if you have another one after 5 minutes, you can give a second one, and that's it, or wait for responders to come.
Yeah, another thing also that you might notice, especially on light-skinned individuals, is that you might see that color return back to their body. I see individuals that are like really pale, right, and then all of a sudden you start seeing that redness come back to their body. You could look around the fingertips or their lips, right? And that's just because they don't have enough oxygen in their body. They went through sinuses, which means not enough oxygen in their blood. So now as they, even though they may not be coming out of it, as they begin to breathe more often, at a higher rate, you see that blood is starting to once again catch its color, get oxygenated, and bring that individual's color back to their skin.
Any questions? Everybody is pretty comfortable, yeah?
Well, what about those people just stop and freeze? What do you do in that case? Because you put that, Narcan up in their nose, they'll probably have a reaction and fall.
Most don't. If they're on the drug, they won't have a reaction. Yeah, most do. But if they do, if you do that and you see some reaction, I would just let it go.
Correct.
Which we'll talk about. Scene safety is going to be everything you learn today is important. Safety is priority.
Right, yeah. And I guess one last thing I just thought about, when they wake up, a lot of individuals they're not gonna admit that they were on drugs, or they may not say, or they're like, well, I'm fine now, and they might try to walk away, right? That Narcan is not permanent. Depending on the amount of drugs that's in their system, it might flake off, and they can drop back into an overdose state, right? So that might be something to let them know, but if they're continuing on that path of I'm good, I'm just gonna keep walking, I'm trying to fight them, to keep them, to just keep an eye on them, and stay on the phone with 911 and let them know, yeah, the individual's wearing this colored shirt, this colored pants, and they walk down the street and turn at this street, and try to at least keep your distance and walk if you feel safe in doing something like that, where you could let first responders know where they are. Because the Narcan may wear out, and when it does, they're gonna go back to an overdose state.
It's still a little unclear about the person who we need to use that on. Are they the ones that have passed out of some reason, or they're still conscious?
So that's a great question. So they would be passed out. The difference between that and a cardiac arrest is for the overdose, they will still have a pulse, okay? So they're breathing, it may look like they're not breathing, it may look like they're breathing once every 2 minutes, which is not sufficient for us. But the pulse will tell you, okay, this person still has a heartbeat, so I don't have to do compressions. And that's when you can check like their eyes and stuff.
Yeah. So those are the physical cues, and then, again, once you rush in, you're looking around, are there any needles, are there any baggies, are there anything else that lets you know, okay, this is more than just a heart attack, right? So let's be careful about how we do that, and if we end up getting these, right, let's try to also get a bunch of gloves near it, so if you need to administer it, you can put some gloves real quickly, scene safety, we'll go over that. DNRs, do not resuscitate forms. They are exactly what they say they are. Some individuals, choose and make this decision with family members and their primary care provider or physicians and say, listen, if I ever go into a cardiac arrest, I do not want CPR performed on you. So there's some times where we as first responders, we arrive on scene, somebody went into cardiac arrest, and even on our way there, we might get told, by the way, you can notify the person has a DNR. If we arrive at scene, that piece of paper, that document has to be shown to us, so we can confirm that indeed that person has a DNR, which often comes as a blank piece of paper. Sometimes it's printed on the pink sheet, so it's distinguishable, and people can see the difference. Some individuals may have a DNR bracelet. If you see them, we still need to confirm it with the form, right? Make sure that it has their name and whatnot. But when you arrive or you are on scene, somebody drop, check your hands, see if you have some DNR bracelet, just keep that on the back of your head. And if there's a family, somebody comes out and say they have a DNR, we're not performing CPR, just stand back. Best you could do is make the person comfortable, right? Depending, see if they fell in an awkward position or something of that nature, right? Respect the wishes of the individual. Obviously, we want to call 911 is the first thing we want to do, because we still have to arrive on scene and we still have to monitor the scene.
And this is more for education, like if you ever see it, you know what it is. If it's somebody, again, if it's somebody on the street that you're helping out, you don't have to worry about this as much. If you have all good intention and you start to help them, you will not be liable for anything, okay? So, and it's better, and I got the question last time, but it's better to try to save a life, than to think they have a phone and then they don't, and the person is gone. So, but this is super important. Again, remember 70-something% of cardiac arrests happen in the home. So if it's a family member, a friend of family, church friend, whoever it is, and you see that on the fridge or around their room, then you know what the form stands for.
If they have a do not resuscitate, but one of the family members still wants to try to save them, like, do you walk them through that, or can you walk them through saving that person even if you don't touch it?
Yeah, if that's on the family members, I guess they decide what they want to do, right? If they don't want to respect those wishes, we're gonna have to deal with that later. As I'm thinking, if I was just a lay person trying to help out and I was in that position, I would just be hands off, right? I'll be like, okay, I see that form, I understand you want to do that. If you want to go ahead, I'll call 911. You know, but yeah. So did that help kind of answer your question? I guess you can guide them.
Yeah, or you guide them even though you can't touch it.
If you feel comfortable in that situation. If you don't, just say, hey, I'll call 911 for you. Like, you don't have to do much, okay? Yeah.
Say the person is on the way to the ER and they in cardiac arrest, if you don't have time to know the papers, how would you know, Gary?
For us, for responders,
Emergency room, anyone.
yep, so for emergency personnel, they usually have that on record. And now most of the records are electronic, like on my chart and stuff like that. So, we also do like what we call medical control, where as a transport agency, so the ambulance, there's like a medical control call on the way to the hospital. So those things can kind of get figured out.
Usually folks choose that DNR they do have it displayed
They
somewhere
do,
because
yes.
of the, whatever illness you're going through,
Mhm.
and they made that decision.
Yeah. And there's times, so by law, as first responders, this is not you guys, this is as responders, we have a duty to act, right? You do not, so don't feel, this is just for education. If you wanna save somebody's life that you love, you know what to do. If you decide that you don't wanna do anything, you wanna call responders, you have every right to do that, right? So I'll make that clear, but as responders, we have a duty to act. So if we do not see that form, but we're told that they have a DNR, we'll look for it really quickly. We don't find it, we'll start compressions, and once that form is found, then we'll stop. Okay? Just because we do compressions doesn't mean that we are gonna bring the person back. What we're doing is we're increasing the chance.
Correct. And also, keep in mind that this is for performing CPR, right, on the patient. Any other type of life-saving, let's say a person is caught, they're bleeding, whatever, we can still perform that, right? But I see this is specific to CPR, that where we would just stand back and respect the wishes of the individual to perform. Being safety. Needles or drugs. We show up on scene, we look up, as far as right, we look down, we look sideways, we don't wanna get tunnel vision. As individuals who are gonna be stepping into scenes or may step into a scene, when you step in, you're like, whoa, you see a body, you see somebody, doesn't look normal, doesn't sound normal, take a second to look around, right? Your priority, right, your safety, right, we don't wanna have two bodies. So needles or drugs, things like that on the floor, you don't wanna go poke, you don't wanna touch a powder or something that you don't know what it is, and then have it seep into your skin, into your system, and you overdose, right, trying to help somebody. Combative patients, we mentioned that the Narcan, but in general, you don't know what a person may be on, if they become combative, you don't wanna help, but I'm not gonna get a punch to the face because you're not in the right state of mind at this point, right? So, call 911 and take a step back, monitor them as they go, and unfortunately, again, taking that step back so you don't become a patient. Environment, traffic, crowds, weapons. There's sometimes people, we see this up in, I don't want to name streets, but someone's not in the right state of mind and they're walking to the middle of the road. You're like, oh my God, what are you doing? You're gonna hurt yourself. You run out there trying to get them out the streets. You might hurt yourself, right? Or there may be incidences where somebody overdoses while they're driving because they bought what they bought, they took it on their car ride, and then on their way to their house outside to get out the city, they overdose, right? Which I've been to plenty of those type of scenes, and they crash into another vehicle, they crash into a light post, they crash into a building or whatever. Sometimes they're in the middle of the street and you might be beeping at that horn and this person's not moving and it's 3 lights ago and this person's still there, and then you might come back around and the person look like they're asleep on their vehicle. Take a step back, car's still on, their foot may be on the brake, the car's still on drive. You scare them, bump on that window, you scare them, oh! They hit the gas, boom, there you go. Or you trying to open up that door because, hey, sir, you scare them, they might, you know? So take that step back, call 911, let them know what's going on. Don't put yourself in danger, right? And again, weapons, anything is a weapon. They're trying to harm you, trying to hurt themselves. Keep that distance, okay? And just call 911 and report what you see and what's going on. And sometimes you might even have to think about calling 911 away from the individual because they're very actively calling 911, may enrage somebody to take action against you, right? So just back up, go back to your own safety spot, your own vehicle, your own room, whatever, and initiate that phone call from a local location where you can be safe. Questions?
So I actually want to mention 2 things, which I did not mention. When we're talking about Narcan, don't assume that somebody in the house isn't going through an overdose because we get prescribed pain medications for surgeries, for whatever's going on. And sometimes, I don't know about you guys, but I forget whether I take medication or not. I'm like, did I take that? Well, let me take it just in case, 'cause, right? So that can happen at home too. Again, look for the depressed breathing, and the pupils will tell you if it's an opioid, right? So, and don't assume that just because they're home, or it's a family member, that it's not an opioid overdose, because it's not always needles and heroin, right? It can present various ways. So that was, painkillers. So, that was my one point. And then my other point was, this is the church AD, and Bishop, can you tell us where this is placed?
Yes, as soon as you come inside the door, right on the wall, immediately there's a white box with a window in it, and that's where the AED is kept. So it's to your immediate right, so before you get to my office, it's on that wall.
Awesome. And then there's an extra battery in here. Okay, perfect. Oh, and this is amazing. He has the shears to open up the shirt. And gloves.
All right, Bishop.
So you guys are in good hands.
Yes, we are.
So, yes, any questions? Did you guys get something out of this?
Very nice.
Thank you for having us.
And you, Lieutenant Sierra, and firefighter crews, they see a lot of this, and thank God you don't. But in the event that you come across a situation, whether it's family, friends, or total strangers, at least now you have some knowledge that you may be able to help somebody come back, or, end up living a quality of life they just lost, And so the one thing you want to do is, or you not do, is just do nothing. You have this training now, you want to do something. I'm glad you all had some hands-on, because you can see it's not the easiest thing. You can get tired real quick, especially if this is not something you've been trained in doing. Please remember to keep your arms straight. Otherwise, you're not going to give the kind of compressions normally that's needed. And my shade, I'm just hiding. Something bit me when I was playing golf yesterday and got me all swole up, so I don't want y'all to see that anymore. So, but yes, if you can get somebody around, hey, could you come help, after you've called 911 or what have you, or had someone call 911, if you can get someone there to relieve you, it's gonna be important, because you'll get tired, and if there's no one to relieve you, then it kind of undermines what you've just done. You want those compressions to keep going, and as it's already been shared, you see what I'm doing, see where my hands are placed, can you do this for a little while? And then be prepared to come and be their relief or get some other folk, just in case the emergency responders are not there. Can we give Lieutenant Sierra here, you all did a fine job. I'm gonna have to talk with my buddy, your boss, and tell him you did all right. Yeah.
5 stars all around, I appreciate it.
5 stars.
Sure. You can pay me later. Any other questions?
No, just a comment. I really did find it helpful, so thank you.
you.
I like how simplified you made the process. I was a little nervous. Am I gonna remember all the steps? But no, you gave us great tips, especially the Staying Alive song.
Remember that, yeah.
I want to put that on your phone.
Right, that's
There's
right.
a song for the teenagers too, but we don't want to listen.
Also, I'd like to encourage you, those of you, you're in other environments, other people, maybe pastors, maybe workplaces, whatever, you can share with them. You know something about what this training is like now. It's not much time, but a lot of good information. And the more people who know and understand what to do in a situation that requires this kind of engagement, the better, the better. And who can tell? Hopefully it'll never be us or any of our loved ones. It's just good to know if you need it. I was thinking you all might say something about the Heimlich maneuver. If someone is choking, to me that's so important. And it can be kind of common too that folk choke on food. And so maybe you all say something about that.
I'll do it.
So, first things first, when people are choking, they're gonna let you know, alright? So the overall.
First I need, who's gonna feed me? I need some food.
Choke some mac and cheese. Universal sign for choking, I don't know if you've seen it before, but you know they're grabbing at their throat because they're all of a sudden, now they're speaking sign language, they're trying to communicate with you that, hey, I can't breathe, right? They're looking despair, they can't breathe, right? And if they can't breathe in time, they might even pass out, right? At that point, we want to assist by removing that obstruction, by performing the Hamlet maneuver, right? And
Choke.
let me do work.
You can say what you're doing.
No, so you know when you want to press underneath the sternum, right, which is the middle part of the body right here, right? And we want to push in and up, right? That's going to create that pressure. Whatever air may be in there, pull it up, and make the individual cough up, right? And you want to perform a couple of them, right? If you can't remove that obstruction and that person ends up going limp on you, now we're switching gears. Now the person, we want to place them on the floor, right? If they're not breathing at this point, we want to open up their mouth if we can. If you see it, you can put some finger sweep to try to get it out. But if you can't see it, put your fingers in there. At that point, if the person goes down, now they're not breathing, they may not have a pulse. It can get to the point where you have to perform CPR on the individual to try to keep that blood circulating.
Even with the rockets still there?
Yes, because that's preventing the individual from breathing through his airway, but the oxygen in the blood that's already in his system, we want to make sure that it's moving around.
I was just gonna say, if you are alone and that happens, this chair's kind of small.
Oh, yeah, that's
You can do is kind of like, again, right under the sternum. You can try to just push yourself really hard there, and it'll explode it out.
Okay.
Body weight.
And if it's a baby?
Maybe, so what we would do if this was a baby, we would, face down, take a little, like, cup your arm like you're holding a baby, and just tap it back. And that's typically.
Yeah.
If you don't do that, someone's talking choking.
What?
Hit a wrong person in the back, because they have done that.
Oh, yeah, no, the best thing for an adult is to get.
The Hamlet, you might get a baby or infant might be on the side, like the transfer is shown, or also facing them down like this. If they feel on your forearm, you just give them back shots, let gravity do that work, while you hand them back.
Got a question. Go ahead.
Well,
You
what
first.
If the person starts choking and then go into a seizure, what do you do after you call 911?
Honestly, if you tried the Hamlet and that didn't work and they're seizing now, have them on their side. So seizures, there's nothing you can really do for seizures, other than put them on their side so they don't aspirate. That might also help with whatever's lodged in there. Again, and you can, I don't know if you, it's not a, you just want to try to put weight here so that could expel, right? So that's the thing. But being, for seizures or anything like that, just have them on their side.
Yeah, that's neurological. At that point, you don't want them to bite their tongue. You don't want them to hurt themselves. They got to go through that process. If they're seizing and they're choking, that's a bad spot to be on. But it always going to go down to, can that person breathe? So our priority is breathing, airway. So our ABCs are airways, primary.
Now, if something else happens to them, they're having a real bad day, and I will.
When you were performing the Heimlich, did you have to brace yourself? Because you're gonna sweep up, right? So do you need to brace yourself?
Yeah,
You want to do as much power as you can.
She's heavy, so I had to.
Remember that CPR? Oh my God.
She said I had a hairy back.
Good point.
So yeah, you wanna get your posture, posture, right?
See, God don't like us.
That's English as a second. You wanna get your posture right? Bend your knees a little bit, if that person not that taller than you, that way you can get your center of gravity. We don't wanna use our back, we wanna use our lower body and upper body, get our hands around, and when we push up and in, boom, right?
Like this?
And I'm going in, yeah. So in, and up.
This way.
What if you really can't reach around them? They have, I'm serious, like,
Yeah.
Yeah.
a person, how would you do the Heimlich?
If they're conscious, try to do the chair thing or direct them to do the chair. And if not, like if it gets to that point, I would just have them, if they go down, have them on their side and try to get, help gravity as much as you can. There's only so much you can do. But no, it's a great question. But I say the chair thing will probably be the best throw.
Yeah.
Also, if you're doing that Heimlich maneuver, don't be afraid to be close to the person. You gotta hold them close, because you're gonna be the thing that causes that pressure to cause the thing to expel. So, it's not away from you. You wanna hold them close to you, and when you bring in, you wanna do it with a jerking motion, as it were, to kind of force the obstruction out.
What if we can see the object and you can pull it out?
Then you could do the.
Yeah,
the fingers.
or mouse.
Also, another sign that people give is not just this. Sometimes they'll say, like, pat me on my back, 'cause so many have been told, you can pat the back. So that may be
That's a good point too. And what I find is, when something goes down the wrong pipe.
Oh, yeah.
So sometimes you won't catch it right away because people will go and they'll try to walk away because they're embarrassed or whatever. They don't want to like cough or be teary-eyed in front of you. Keep an eye on them. They could be choking. I think most often than not, people try to like figure it out themselves and they walk away and they're like,
Yeah.
And then you say, take a knee and.
Right.
Also, one other thing, if a person is coughing, even though they're choking, they're still good. Because you still have an exchange of air going on. But when they cannot cough, they cannot exchange air, that's when you may need to do the Heimlich.
That part can, Thank you. Good point.
This is teamwork, man. Teamwork is teamwork.
Thank you so much for having us.
You're welcome. You're welcome. Any other questions?
All right.
Okay, let's give them another hand. Thank you.
You could pass these down.